Welcome to the Pharmacist Voice Podcast, episode 332. I'm your host, Ohio pharmacist Kim Newlove. The show notes are on thepharmacistvoice.com. We are talking about social stories today. What is a social story? You'll find out in just a minute. We'll cover what a social story is and how you can use one to help a patient feel more comfortable about getting a shot. This is not my typical type of an episode, but it combines two of my roles really nicely. Which two roles? Pharmacist and caregiver. I am a full time caregiver for my adult son who has autism. His name is Craig, and he is 22 years old. He's supposed to be sleeping right now as I record this. Imagine this. In February 2025, so just this year, a few months ago, Craig needed to get a tetanus shot, or a Tdap booster, if you will, at our local pharmacy. Craig doesn't like getting shots, but he needed one. He was due for it. What's a pharmacist mom and caregiver to do? I prepared him using a social story. How'd it work? The prep paid off. Craig did great with his shot. Really great. Much to my relief and the relief of the pharmacist who gave him the shot. I was not the pharmacist who gave him the shot. Bottom line here, social stories work for Craig. They can work for your patients too. Social stories prepare people for situations. They don't have to have autism, they could prepare any person for a situation. It could be a shot, like we're talking about today. It could be going to the dentist, going on vacation to someplace you have never gone before, or maybe something else. And the story could be for a child, a person with a disability, like my son, an older adult with a memory issue, or in the case of getting a shot, people who are afraid of needles. And from my research for this episode, I have discovered that that's like 10% of the population in the United States. 10% of people are afraid of needles. Who knew? Well, my son Craig is both afraid of needles, I think, and has a developmental disability, autism. Craig needs and responds well to social stories. Use what works. Some of your patients might benefit from using social stories too. So, what is a social story? How do you write one? And how do you use one? Especially, when do you use a social story? Do you use it the minute before you give the shot, or do you do it a week before? We'll cover all these questions right now. Let's start with, what is a social story? Social stories are short, simple stories that prepare someone for a situation. These are not fairy tales from a book. There's no heroes and villains. This is just a short, simple story. Definitely avoid medical jargon. These really need to be in layman's terms. Now, in the case of getting a shot, you are trying to make getting a shot predictable for your patient. You are making it predictable by explaining what's going to happen before it happens in layman's terms. Empathy is so important. You have to focus on them and their experience. I'm guessing that you're listening to this because you're a pharmacist, a student, or a pharmacy tech. So I want you to know that in a social story, you're not explaining what you're doing. You're not talking about how you need to go to the back to get the shot and draw it up and all the things that you're doing. No, it's actually all about making the patient experience predictable in a way that they can understand. So only talk about the things that are going to happen to them. Now, here's an example. It is not perfect, but it is a valid written social story. So I literally wrote this out and I will read it to you. And it features my son, Craig. Craig, Dr. Smith needs you to get a shot so you stay healthy. We're practicing today. The pharmacist will give you a shot at the drugstore. When he sits next to you, he will wear medical exam gloves and he'll have a syringe with a needle on it, an alcohol swab, and a band aid. The pharmacist will talk to you first and tell you what he's doing before he does it. He'll roll up your sleeve so he can see your arm. Then he'll touch your arm with the alcohol swab. The swab will be cold and smell funny. Next, the pharmacist will take the cap off the needle and inject the medicine into your arm. It will feel like someone is pushing on your arm, and you will feel a small pinch. Keep your arm at your side until the needle is out. Then the pharmacist will put a band aid on your arm. You are done when the band aid's on your arm and the pharmacist tells you that he's all done and he walks away. The end. Let's review that story. I mentioned what's happening and why. It's a shot for your health. Who's giving the shot? It's the pharmacist. In Craig's story, the pharmacist happens to be a man. If you write a social story for a person, make sure that you make the details relevant to that person that you're writing it for. Back to the review here. What will Craig see? He'll see the pharmacist, gloves, a syringe with a needle, an alcohol swab, and a band aid. What will Craig hear? Craig will hear the pharmacist say what's going to happen before it happens. What will Craig smell? The alcohol swab. What will Craig feel? His sleeve being rolled up, the cold alcohol swab, pressure and a pinch, and the bandage on his arm. How should he respond? Arm at his side until the needle's out. How will Craig know when it's done? When the band aid's on his arm and the pharmacist tells him he's all done and walks away. The end. See, that story should make sense to you if you're looking at it from the patient's perspective. When I write social stories, I pair words with images. It should kind of remind you of a mini PowerPoint presentation where there's a single image and there's just a sentence or two. It's not very wordy. Remember, it's simple layman's terms. Sometimes I write social stories in second person, other times it's in third person. So Craig goes to the pharmacy, Craig gets a shot. You get the idea. Whatever your patient will understand and respond to, that's what you should use. For Craig and his social story about getting a shot, I gathered real life objects instead of typing out a story and pairing the words with the images. Again, think PowerPoint presentation slides. I did not do that. I just spoke to him and had these real life objects. I am very experienced at using social stories. So I basically spoke this story to Craig on the fly from memory and introduced all the visual aids to him, except I substituted a clickable pen for the syringe with the needle. I do not have needles and syringes around my house. We talked through the story twice. The first time, it was just words and me pointing to the visual aids. And then the second time, I did the actions that the pharmacist would do while I talked through the story. I basically pretended that I was the pharmacist. Listen, if you can create a social story and then record a video of you going through the motions, it would make a great YouTube video for your pharmacy, your clinic, your pharmacy school. There's a lot of different places that a video like this could be used. You and a coworker or a fellow student could get together and do this. Just an idea for you. But for the sake of my example, where I'm the pharmacist and my son's the patient, it went like this. So this is the second time I went through this with him. Craig, Dr. Smith needs you to get a shot so you stay healthy. We're practicing today. I'm going to sit next to you here and wear exam gloves. I've got a pen instead of the shot. I also have an alcohol swab and a band aid. I'm going to roll up your sleeve. Now I'm going to clean your arm with this alcohol swab. It's going to be cold and smell funny. Now I'm going to pretend that this pen right here is the shot. I will put the pen on your arm. When I click the pen, the point will poke you, kind of like the needle will. Click. Keep your arm at your side while I put the band aid on. Then I would apply the band aid. And then I would say, Craig, you're all done. And then I'd walk away, just like the pharmacist would after giving the shot at the pharmacy. The end. Again, you could easily make this social story into a video and post it on social media. Then, when someone with a vaccine hesitant individual schedules a shot, whether it's a parent or a caregiver, you could ask them to review the video before they get their shot. My son Craig needed, I would say, at least 24 hours notice before his shot. We only went through it twice, but that's what he needed. It's really an individual thing. Some people will need to practice for a good week, like twice a day for a week. Others could watch the video while they're waiting in your waiting room for you to draw up their dose and walk it out to them. Everyone's different, but a social story can be shared far in advance if needed. Everyone is different. You could also add your own custom features like affirmations. I don't know if you're into affirmations, but I just learned about them recently. Two examples that I will offer to you here are I stay calm. So the person that you're giving the shot to needs to say, I stay calm, or you say it for them. I stay calm. I stay calm. And that can affirm them that they can stay calm during this shot. Or another one is, the shot keeps me healthy. So they could say these things to themselves. You could say it for them. The shot keeps me healthy. Their caregiver could share it with them. These could be shared in advance. There's lots of custom features that you could include in the social story experience at your pharmacy. You could also record your social story video in the room where you typically give shots. That's another custom way to do a social story. You can also offer coping strategies like deep breathing, like we're going to breathe 5 times before we do this shot. Or you could offer for them to count. Maybe by the time you count to 50, this will be done. Again, these are custom ideas here. You could offer for them to bring comfort items like a stuffed animal, a weighted blanket, something to fidget with, or maybe they could just hold a familiar person's hand. There's lots of different ways that you can work a social story. And the beauty of it is you can just include whatever you want. You can even talk about rewards. What kid doesn't like rewards? Suckers, stickers. I mean, if you offer these things, put them in your social story and record them in your video. There's more than one way to get a social story right. As a pharmacist, you may be thinking, I don't have time to create a social story for my patients. Well, the good news is there may already be one out there that could help you. Check YouTube or Google for options. You don't have to reinvent the wheel. You don't have to do it all by yourself. You don't have to do it alone. You could also hire me to help you with your social story for your pharmacy. I am available by the hour for consulting. Just reach out to me through my website, thepharmacistvoice.com, hit the contact tab, leave me a message. Back to what you could do though, if you're a busy pharmacist, try YouTube or Google for options. And no matter what you do, offer social stories to your patients once you find them. Offer these social stories to the patients who might benefit from them. Every pharmacist has a story of somebody who's vaccine hesitant because they're afraid of needles or they're really young or they've had a bad experience. Those are the people, when you schedule them, that you need to offer these social stories to. They could make a big difference, especially if they are used far enough in advance and with enough repetition to achieve the desired effect. We want patients to show up, get their shots, and have a very good experience and come back and see us next time they need us, right? We're pharmacists. That's what we do. We help people. I think that's all I have to say about social stories. We covered what a social story is, how to write one, and how to use one. Thank you so much for the opportunity to share something from my world with you. I am both a pharmacist and a caregiver. Social stories have helped my son Craig over the years, and they could help you and your patients too. Thank you for listening to the Pharmacist's Voice podcast, episode 332. To find the show notes, go to thepharmacistvoice.com, click the podcast tab, and then find episode 332. In the show notes, you will find basic information about social stories, my social media links, a link to sign up for my monthly newsletter, and more. There are always lots of links in my show notes. Everything you need is on thepharmacistvoice.com. Go ahead and share this episode with anyone you know who might like to learn about social stories. Go ahead and follow this podcast for all future episodes. We've got a lot more coming up here in 2025. Thank you for listening today, and I'll talk to you next week.